G'day. A New Zealand paper has come to my attention which I think is very significant, and I want to talk about it now. So let's get into it. The name of the paper is Adverse Events Following the BNT162B2 mRNA COVID-19 Vaccine in Aotearoa, New Zealand. The vaccine is in actual fact the Pfizer vaccine, or the community vaccine. I'll just refer to the Pfizer vaccine. This paper is significant. It was written by New Zealand Ministry of Health staff, it seems, and also someone from University of Auckland. So what did they find in this paper? Well, let's just drill down a bit. First of all, this paper was a preprint, and it was printed in the Lancet publication. So preprint means that we've got to take it with a grain of salt because there may be some errors in this paper, but I think most of what we're going to discuss is probably true. The study looked at 12 adverse events of special interest, or AESIs. The study period was from the 19th of February 2021 to the 10th of February 2022. The results were compared with similar ailments from 2014 through to 2019. However, those who were second dosed within 21 days were excluded, which is sad because, as we know, a lot of injuries happen within those 21 days, and therefore the results of this study will underrate adverse effects. And also the study excluded overseas and non-Pfizer vaccinated people, and 13,597 people who tested positive during the study were also excluded. So I think some of these people should have been included. Anyway, we move on. And the study group was huge. That was 4,685,351 vaccinated eligible individuals aged 5 and over. And down the bottom here we have the paper, which you can look at yourself at your leisure. Now these are the 12 ailments that were looked at in this study. In red there gives you a rough idea of what these ailments might be. The first two are self-explanatory. Guillain-Barré syndrome is a nervous disorder. Ethemia multiforme, red rash. Herpes zoster, basically shingles, and you need to have chickenpox beforehand, maybe as a child. Single organ cutaneous vasculitis is a red rash. Myocarditis, pericarditis, heart disease issues. Arterial thrombosis is a clot, can lead to strokes or heart disease. Cerebral venous thrombosis, again a clot, and can also lead to stroke. Splanchnic thrombosis is an internal clot. Venous thromboembolism, VTE, is a vein blockage. And thrombocytopenia are low blood platelets. And in this study, half a dozen of the conditions could not be calculated for certain age groups, as events were less than 6. Shown in blue here, and of these, 2 that were not studied at all. 2 of these ailments, remove those, and then of the remaining there were half a dozen that had no association. These 1, 2, 3, 4, 5 ailments showed no association, so we'll remove those, and we're now left with 5, and 3 of which had slight associations. Single organ cutaneous vasculitis had more events than expected for 20 to 39-year-olds on their first dose only. Venous thromboembolism had a slight increase for 40 to 59-year-olds on the first dose only as well, and thrombocytopenia had a slight increase for the second dose only, so of concern. I'll come back to those in a minute. And 2 major results were the statistically significant results for acute kidney injury and myocarditis and pericarditis. Again, statistically significant results for both of these 2 conditions, and again we'll get onto that in a moment. So in the discussion of the paper, they mentioned that they found no association between the Pfizer vaccine and the majority of the 12 selected AESIs, but they did find vaccination was associated with a rare but significant increased risk of myocarditis and pericarditis following both doses of the Pfizer vaccine. Pericarditis is a condition that affects the pericardium, a thin membrane that surrounds your heart, and the symptoms of myocarditis and pericarditis are new onset of chest pain, shortness of breath, or feeling of having a fast beating, fluttering, or pounding heart. And here are the results. Basically what we have here are the observed events here compared with the expected events here. So for the first dose of myocarditis and pericarditis, there were 112 observed events of these conditions, whereas the expected background number was 43.7 events. And that was again from 2014 to 2019, the comparison group. And when you compare these 2 groups, you can see that there's a 2.6 times increase. In other words, this number here is 2.5 times or more larger than this number here. So 2.5 times increase chance of having some heart diseases of this nature after the vaccination. So that's the relative increase risk, but the absolute risk is a lot less, and in this case it's 1.6. If we go to the second dose, the relative risk is 4.1. And then in the second area, they observed more events were expected in the AKI following both doses of the vaccine, and that's acute kidney injury. And just to give a definition of what the acute kidney injury is, we have this definition here. So acute kidney injury, also known as acute renal failure, is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. AKI causes a buildup of waste products in your blood and makes it hard for your kidneys to keep the right balance of fluid in your body. AKI can also affect other organs such as the brain, heart and lungs. So AKI, or acute kidney injury, is a serious condition and one that none of us would want to have. So after the first dose of the Pfizer vaccine, they found there were 2,279 observed events, in other words ailments, whereas the background event was 1,446.2 events. And you can see here there's about a 60% increase, 1.6, about a 60% increase between these two figures, a significant increase in the first dose of the vaccine. And over here you can see that's 19.2. And then if you go to the second dose, you can see that there's a 1.7% increase in relative risk, so about a 70% increase in relative risk. But over here, you can see the increase in absolute risk is about 23. It's the risk of becoming ill with this sickness if you get vaccinated the second time. And who knows, after the third or fourth vaccination, this risk will probably increase again. And finally, we have a slight increase incidence of thrombocytopenia and VTE, remember is venous thromboembolism, were observed following the second dose of the vaccine. And if we go back to VTE, is to do with the vein blockage, and thrombocytopenia is to do with low blood platelets. And again, here are the results for venous thromboembolism. After the second dose, there's about a 20% increase risk of having this sickness as a result of having the second dose of the Pfizer vaccine. So it's a relative risk. The absolute risk is much the same. And for the second dose of the thrombocytopenia, increase by about 30%. So again, that's a significant increase. However, when you look at the absolute risk, again small, but the relative risk is still about 30%. And finally, I want to look at the myopericarditis again, because there's interesting results to do with the 5 to 19-year-olds or teenagers or children. And after the first dose, there was a 9 times increase, a relative risk of sickness. So you can see there's about 9 times. If you multiply 1.2 by 9, you'll get 11. And it's about 9 times increase in relative risk. Now the absolute risk is again small, 1.5. If we go to the second dose, the absolute risk is 4.6. And we look at the relative risk, again it is huge, 25 times. And you can see the number of expected events is almost 0.9, whereas the actual events were 23. In 1 year we had 23 observed events in this age group, 5 to 19. So young people are getting this hugely more than they were in previous years. This is myocarditis and pericarditis. And this alone is reason why all childhood vaccinations should immediately be stopped. This is an outrageous figure. We are damaging our children's hearts by having Pfizer vaccines continued. And the Ministry of Health should look at their own data, their very own data, and stop the administration of vaccines to our children, because it's obviously dangerous. And if we look at the CALM results themselves, we can see myocarditis and pericarditis. There have been 974 reported cases already, and it has now exceeded the background rate of 931. If you compare all the other sicknesses that have been reported, are still significantly lower than the background rates. But for myocarditis and pericarditis, it is the one sickness where it's exceeding the background rate. And that again is a reason why Pfizer vaccinations should not only be stopped for all children, but they should also stop for adults as well. Because you can see there's a huge number of reported cases in our CALM system, and this has to be listened to and taken note of. Down the bottom here you can see the acute kidney injury rate. There's been 30 reported cases already, and that is significant. And finally, of even more concern, the Immunisation Advisory Centre has put out notification that there will soon be community or Pfizer vaccinating high risk 6 months to 4-year-olds. 6 months to 4-year-olds, they're going to increase the number of vaccinations. Who are these high risk children? Well, according to their own publication, they are children who have complex chronic medical conditions, including severe neurodevelopmental conditions or primary and acquired immunodeficiency, or are on immunosuppressive therapy, such as undergoing treatment for cancer or transplant. So basically what they want to do is to put this very dangerous vaccine into the veins of our most vulnerable children who are immunodeficient. Surely that's a terrible thing to do. You're just going to make the conditions worse. How could they do these things? They should be stopping them for all children, for all people, never alone for the most severely immunodeficient children that we have. They should take their own research into account and stop all Pfizer vaccines immediately. The Ministry of Health should look at their own results from their very own paper. Their own research demands this. It is time to stop injuring New Zealanders. Stop the vaccine program now, please, Ministry of Health. Thank you for watching this video. Bye.